Hi friends, and good morning. I guess this is our first effort to actually go live on all the three platforms simultaneously: Instagram, YouTube, and Facebook. But today is going to have a small case discussion, especially when endometriosis and deep endometriosis is one of the causes of failed IVF. So we need to understand that the medical opinion is pretty straightforward, that if the patient is not having any pain, that means asymptomatic endometriosis, and even if there is deep endometriosis and fertility is a priority, so in that situation we are supposed to give priority to fertility, and whatever IVF or whatever is required, we are supposed to do IVF. But today we have a patient with us who is now pregnant, and we have operated her approximately 3.5 months back, and her past history is of having 3 IVF cycles failed with an excellent fertility specialist, excellent quality of embryos. But we need to understand one thing, that in all these types of situations, what goes wrong is that there is a presence of a rectal nodule. Along with that, there is an adenomyosis in the posterior aspect of the uterus. So even if you give your suppression, which is in the form either of oral contraceptive pills or in the form of GnRH analogs like Leupride, Zoladex, whatever depots you are trying to give, this patient may not conceive only with IVF. Okay, one of the reasons where such large uteruses, 8.5, 9 centimeter uteruses, have repeated IVF failures despite having good quality embryos is purely because of this situation, right? So what we did differently as far as this situation is concerned, frankly, nothing much. We posted her for a surgery. We cleared off the entire endometriosis, and simultaneously for her, we did something called as microwave ablation. All of you are actually aware that we now pioneer as far as microwave ablation and subtle ablation techniques are concerned based on mapping. We wait for 2 to 3 months. The volume of the uterus goes down by approximately 25%. Following that, all the adhesions get cleared. The patient goes back to the same consultant. They have done an embryo transfer. Of course, he is a very dear friend of mine, so they have done the embryo transfer, and the patient is now pregnant with almost the same set of everything. So you know what it does is, if this is done properly, in this situation the patient has this great benefit of having an improved fertility outcome despite having no pain. Okay, but the patient is having grade 4 endometriosis. So this is something which all of us should keep in mind. This is something which all of us should consider before we do IVF, especially when there is grade 4 endometriosis. And for that, mapping and diagnosis of grade 4 endometriosis is much more important rather than hastily taking the patient in for IVF. I also want to tell one more thing. If in endometriosis surgery we are able to correct the fallopian tubes for the patient, and if the fallopian tubes become okay for the patient, then every year we have approximately 40 to 70 such couples who conceive naturally after this, right? So probably the only indication for IVF in them was grade 4 endometriosis, and once you do a good surgery for grade 4 endometriosis, then IVF is no longer an indication. Then these people can end up conceiving naturally. And because we are a referral unit for endometriosis, we have a lot of these patients who end up conceiving naturally with us every year. But this was a good case. I thought I should be sharing, and just that's the reason why I went live. So guys, thank you so much, and I'll be very happy to answer your doubts over Instagram as well as on Facebook and on YouTube. And I wish you all a very nice day. Thank you so much, and bye bye.